This is the story of 4 phone calls made over 10 years. In 2015, on a chilly November night, a young resident called Professor Rajesh Malhotra at 11 p.m. Sir, my thesis deadline is approaching. It's 350 cases. I cannot make sense of the data. Please help. And Professor Malhotra calmly replied, "Beta, I have a US flight tomorrow. Give me whatever you have and I'll figure it out." So the young resident, that's me, I drove to his house at 5 a.m., gave him all the papers, and the result, I achieved a rare feat of publishing 5 papers out of my thesis. And the second phone call happened in 2019. I called him up and told him, "Professor, there is an opening for faculty position in AIIMS New Delhi, but I want to go to Germany to train even more in shoulder surgery." Then Professor Malhotra said, "Beta, you are definitely one of the most deserving candidates, but go where your heart takes you, and remember, make me proud." And the third phone call happened in 2023. I called him up and said, "Sir, I am now a shoulder surgeon in Munich, but I miss home." He said, "Koi nahi beta, come to Delhi, I'll help you settle in. Main hoon na." And the fourth phone call in October 2024, when I called him and asked him, "Sir, will you be my first guest on this podcast?" And he happily obliged. And you guys made it a super hit. More than 50k views, 1,500 comments. So we are bringing him back. I learn from him every day. But like a jealous husband, I'm not keeping him all for myself. So here he is.
So guys, let's welcome Professor Dr. Rajesh Malhotra and bombard him with so many questions. Thank you so much, sir. Thank you for coming.
Thank you for having me.
Sir, the million-dollar question. Do medicos ever become rich?
So I believe that medicine is not a great profession for making money or getting rich. There are several other professions where you can become rich by putting in much less effort and with much less responsibility and stress. But the medicine is like any other ikigai, which means that you have a certain talent. There is a demand for it and you get paid for it. So you'll always be very comfortable about money. But talking about, unless you are in US and talking about owning private jets, it'll be difficult in India.
But sir, are there some branches which you can earn a little more money?
Yeah, of course. So everything comes at a price. So you may be a neurosurgeon, cardiothoracic surgeon, or even an orthopedic surgeon. But the fact is that, somewhere, if you want to make too much of money, you'll have to, disturb the work-life balance. Because if you are being paid too much, like my mom used to say, "Kaam pyara hota hai, charm pyara nahi hota," which means that nobody loves you for your skin. They love you for your work. And nobody will give you money because of how you look, unless, of course, you're a model or in fashion industry. But no doctor will get money on how he looks, except you maybe. So, but other than that, I mean, you have to deliver. And your value and the money associated with it is directly derived from the trust you earn for the patients, the competence and the skills you have, how soon you can get them to get back to their normal. So a lot of things define success, and most of all, your communication skills. So yes, successful surgeons are affluent, they are rich, but don't ask me to define how much rich. But the only difference between, I think, being rich in medicine and being very, very rich in any other profession is, I think, the kind of job satisfaction which you have in medicine, if you really enjoy doing it, is unparalleled. Because I always say, when a gynecologist hands over a baby to a couple who hasn't had a child in, say, 10 or 15 years of their marriage, that joy cannot be brought about by, any other profession, even if it's giving you much more money.
Well said, sir. So next question, work-life balance. Is it possible? And if possible, which branches?
You have to be brutal if you want to have work-life balance in medicine, which means that, you have to put your emotions aside be very sort of objective and say, look, these are my boundaries. I work only from say 8 o'clock to 6 o'clock, and I don't work Saturdays and Sundays. So obviously the work-life balance with doctors is a concept which is actually almost alien to the doctors. Because and I think still, if you really want to do it, you can do it. For instance, even if you are in a specialty which is very demanding, you can have a group practice. You can have 4 or 5 people or 3
Right.
people can be together, so that everybody gets to go on a holiday. But it is still the ideal holiday will be where the mobiles are switched off. The doctors can't have that kind of holiday where the mobiles are
Right.
switched off. So real work-life balance is going with your family to a holiday and forgetting or leaving your mobile phone at home. And that's what it is. But having said that, I think the doctors also need to spend time with their family. Sometimes somebody once asked, what do children of doctors want to be? And somebody said patients, because that way they get more time and they get more attention, and they
Right.
feel neglected, and they feel that if you're in the middle of a movie with your dad and the dad gets a call and he has to get his car out from the parking and you have to take a cab back home with your mom alone, you're going to think dad is either he'll become your hero, or he'll become one guy who is not interested in his family. So
Right.
these are challenges, and it's a tightrope walk. But then, having said that, the life-work balance or work-life balance is extremely important for you to even deliver to your patients.
So why did you choose ortho?
I chose ortho because that would be one of the ways how people choose. When I was a medical student, my mother got a hip fracture, and she was treated. Unfortunately, she had several complications. We nearly lost her. She became all right. But then I had a time to interact because I was in AIIMS. My mother was admitted in AIIMS. So I had a long interaction with the orthopedic department faculty. And I really got motivated. So I think those are the things which will drive you. If you see somebody from your family being unwell and being looked after by a particular specialty, and you see how your near and dear ones were looked after, that may be one step towards getting close to a specialty
Right.
and getting close there. Second thing is, I always, sort of disliked or, felt bad about physical disability. So that is what drove me to do things, crazy things, if you like. When I was training, there were people who the poliomyelitis were very common. The people who had hip and knee contractures. So I was probably the first person in the department who started operating on 2, 3, and 4 joints in the single sitting, so that the person is back to his feet at the earliest, wearing calipers and all. The same thing about 15 years later translated into doing 4 joint replacements in a single patient on the same day, both hips and both knees, because I really abhor somebody being dependent on someone else or being bedridden. I had my best friend whose aunt had a rheumatoid arthritis, and we were like 8 years old or 9 years old, and his nanny was bedridden for throughout her life and was always tended to, and these my friend, his sister, his elder brother, they used to tend to her. She had to be fed, she had to be cleaned, she had to be bathed, she had to be dressed. And I thought, for you to have quality in life, you should be, as far as possible, you should be independent. And I thought that at least the day-to-day activities, your chores, you're getting dressed, you're being independent, you're able to walk around. The orthopedic problems are the biggest hindrance, whether it's a fracture or a joint problem.
Right.
So if you, and then you keep them moving, the patients, their joints, their bodies, just keep them moving. And
Yes,
that
sir.
was the inspiration for me.
In fact, sir, we have all heard of your heroic stories in the earthquake times, sir. The Bhuj earthquake. So you, in fact, did an amputation in the field.
Lying down on my tummy with a beam which was a couple of inches above my head. And if I moved my head a little bit, I would hit the beam. And but it was something which had to be done, and there was a constant threat of the rubble crashing on it, because it looked like something like a ground floor, which was actually the fifth floor of the building.
Oh.
And for me it was important to do it because this lady was lying next to her dead husband for 3 days.
Oh.
And her son, I mean, really salute him. He was bringing food to her, cleaning up, crawling inside, getting food and water to her, barely keeping her alive, but couldn't bear to see her pain, couldn't bear to see her suffering. And the dread of, just being inches away from the body of your dead husband who was crushed under the same beam. I think life teaches you a lot, and it also tells you so much you have to be grateful to God for.
Sir, do you think for surgical specialties, the females should not fear it anymore? They should be more in the surgical specialty. Are there still gender stereotypes hindering them?
Well, no, because now my elder brother is from Air Force, 43rd NDA, and now the first batch of female cadets from the NDA has passed out. We have the armed forces personnel who were in the forefront during Operation Sindoor.
Absolutely.
So I don't think that it is now not a gender neutral specialty anymore. There's nothing which ladies can't do. In fact, the endurance is much more. And orthopedics was initially, when I was training, somebody looked at me and said, "Oh, you have a small frame. How will you become orthopedic surgeon?" So I said, "Look at two of my seniors, and
Yes, sir.
I said, the brain works is smarter than the brawn, and the
Right.
and you really don't have to. It does matter to have physical strength." But I think the females can do it, and not only that they can be surgeons. They no more strive only to be, usually the female orthopedic surgeons would go for pediatric orthopedics because they like to tend to small children, and it's not about physical strength or workout anymore, or big time physical labor, or they would become hand surgeons. But now they are becoming arthroplasty surgeons, they are
Right.
tumor surgeons, they are spine surgeons. So I think, and in fact, if you see a lady, classically we used to see our mothers do crochet or knitting and all. I think their skills actually, the surgical skills may actually be better. The finish with which
Right.
they do. So if they can fight the shoulder to shoulder with the men at the front, they can do those long night duties or those amputations at night in a crash injury, or operating
Right,
on
absolutely.
this thing. So I think that is now a thing of the past, and there is no specialty, I'll say, is meant for men alone, or where women cannot venture.
Sir, I think some people are lucky when they know what specialty they like during MBBS. But then there are a lot of them who are confused. But there is a clear demarcation between surgical bent of mind and medical bent of mind. So do you see that demarcation? Do you have any tips for that?
So one thing is, because if you find that the blood loss and the dissection and all, not some people will decide early in their career, and they know that they are not very good at surgical thing, or they don't want to do it, or they don't want to sort of go in the middle of the night to reopen a patient. So emergency visits are for all specialties. But in most cases, a dermatologist will go see, give some medicines, and maybe come back after half an hour, whereas a surgeon may be away for whole night. But I think the more important message I want to give is that the distinction between medical and surgical lines is now blurring, because more and more physicians are into interventional things. So the radiologists are now interventional radiologists. So the responsibility on an interventional radiologist is same as that on a surgeon, because if you have done a procedure and your patient gets a complication or is in pain, you have to go in the middle of the night and see and tend to him. And similarly, I am a surgeon, but I take pride in treating my patients with osteoporosis. right?
Hmm.
Although I still not gone on to give disease-modifying drugs to rheumatoid patients or inflammatory bowel disease, but I know many of inflammatory arthritis. But I know of many of my colleagues who give the disease-modifying anti-rheumatic drugs. So it is blurring, because ultimately, at the end of the day, you have to do what you love doing. So whether it is medical or a surgical thing, number one, first decide, I'm never going to do this. So put it aside. That's all. That's what my son has taught me. So he is very clear about what he doesn't want. Although he is clear about what he wants also, but he is very clear that when he was in 10th, he says, look, don't want to particularly become a doctor, but I don't want to do maths. I don't want to do the geography. I don't want to do history. So I'm very clear about it. So by exclusion, the only thing which was left was, the biology, physics, and chemistry. So he said, fine, then I'll become a doctor. So, but then one thing is, if you must always choose what you have passion for. And if you don't have the passion, develop the passion, because the quality in your work will come, whether it's a medical field or a surgical field. If you are born for interventions, to do procedures on people, the destiny will take you from. The cardiologists, they do now so many different procedures, and many of them are now replacing the interventional neuroradiologists. They are doing things which take away the need for doing neurosurgery. And the people have gamma knife, they have everything which doesn't need you to really become a surgeon. So what I'm saying is that, one, the line is blurring. Two is, decide what is not palatable to you, which you never like to do it. For example, boys mostly know that whether they're interested in doing gynecology or not, right? So that is the kind of very broad criteria I'm applying. Usually when you think about it, most people will be able to shortlist to 3 or 4 subjects, which would be their preferred subjects. And then I think you should just prioritize them. If you want mainly a surgical specialty, so you want to be a surgeon, but there are 2 types of people who want to be surgeons. Some want to go for big surgery, like, neurosurgery and, the cardiothoracic surgery. Right. And they are not bothered. They can work 24 hours a day, 24 into 7. They say, I want to be a famous surgeon, a neurosurgeon, a cardiac surgeon. The others are more practical. They say, look, I want to make money, but I want to be surgeon. I'll take urology. I'll take out prostate, I'll take out cancer, I'll do robotic, I'll have fun with my toys also. So that's also important. You like playing with toys. The surgery is the field for you, right? So you like to play with toys. So then that is the thing. The third thing is, like, I had a postgraduate. He did orthopedics MS, did it, and then went to US and joined physical medical and medicine and rehabilitation. He says, this is a good life. I play golf. I'm off from work. I work 10 to 5. That work-life balance. I play golf every day. So it all depends on what your priorities are. So your priorities are, number one, you want to do something which you will love doing, or you think you will be doing, which will make you famous, which will make you rich, or which you enjoy doing. You have to decide what you want to do. Then prioritize them. It is not always, people are not always lucky to get what they want. But I think you should settle, because you should then settle that I'll take, if I get any one of these 4. And second thing is that when we were young, it was often asked whether it is good to do a very glamorous specialty from a very low-key college, or to do a low-key specialty from a very prestigious institution. So what do you think is the answer? You have trained in one of the best institutions in the country. So that's what my answer would be. But do your homework and find that if that department is very good, you could become a microbiologist at AIIMS, which may be better than being a gastroenterologist in some remote area where you don't have much exposure to the patients and you don't gain that much of... It's just a thought process. I'm just saying, because I think the post-graduation is something which is the very foundation of your career. And you have to learn to love, whether you got in there by accident or by compulsion or because that was the only thing, or maybe it was your fourth attempt, maybe you accepted it. Fine. Once you accepted it, now it's not a question of what you could have been. Now it's what you are, what you are going to do, and how you are going to make it the best thing about your profession for the rest of your life. And then you have to work accordingly. And every specialty, I can tell you, being a doctor, there are times when you hate it. There are times when you love it, I loved orthopedics, but I never liked amputating legs which were crushed. I would think that maybe this is a life-saving thing, so I have to do it. Looking at big cancers coming out of the skin, fungating. But then this is what it is. There are pleasant aspects, unpleasant aspects. But then once you are there, you have to master it all. You have to, my father used to say, if you can't get what you like, you must like what you get. It's all right. There is a certain merit in working hard for what you want, but you must draw the limits. Like you say, okay, I want to be a pediatrician. So I will give it my best for 3 attempts. In the 3rd attempt, if I am not getting pediatrics, I'll move away. Maybe the destiny doesn't want me to become a pediatrician. So finished. That's all. That's the end of it. So what is, if I'm not a pediatrician, what am I going to be? So that's my 2nd priority, 3rd priority, 4th priority. Right. And then if you are getting 2 different specialities, which you like equally in 2 different colleges, obviously you look at which is a better college, which has got better faculty, which has got a better track record. But remember, I have seen people from small colleges do very, very well, even to make it to institutions like AIIMS. So don't berate a college, There's some, it's like this, it's like going for clothes. So some people will always go and buy branded clothes. But there are other people who say, I buy the price, say for example, shoes from Agra for 1/10 the price, the same shoes which are sold in a retail in Delhi for 10 times as much price. And I'm getting value for my money. So it is, once you have joined, you don't judge your college, you don't judge your specialty, you don't judge anything. Say, this is what I'm going to do it. And I used to say, even if you want to become a cobbler so good that nobody would like to have his shoes mended by anybody else. So you become indispensable. Like you say, okay, I know I can go to anybody, but I'll go to this man for this work because he's the best. And that will happen with your commitment and with the specialty. And let me also tell you one more thing, which I always say. It is all right to aim big, always aim big, never aim low. And try to do this. But I can tell you 2 things. One, that the destiny has plans for you which you don't know. And I do believe strongly in that. And one day you will think that the things which you never planned for, the things which you never expected to happen, the things which you were pushed into, landed you in a situation which you could have not done by your will and hard work and all efforts. The nature will open doors for you. It will knock at your door. It will give you opportunities. The problem with the opportunities, it is said, is that they come cloaked in the guise of hard work.
Right.
And nobody, and the life is the outcome of choices we make. So if we choose to accept a challenge, pick up the gauntlet and say, fine, it is tough. I always used to study hard about the topic which I used to find most difficult. There's a book which is called Eat That Frog. Okay. Eating the frog is most despicable thing to do.
Right.
And the person says there'll be tasks in front of you. There'll be one which is most unpleasant. That's the frog. Eat it first. People keep on procrastinating and keep on avoiding it. So work on your weaknesses, but also work on your strengths. In fact, if you have to work on 2 of them, work more on your strengths.
Okay. Right.
Because with your weaknesses, by working hard, you may bring them from weakness to average. By working on your strength, you can bring them from good to excellent.
Right.
But the other thing which I always say is that life is like a jigsaw puzzle. And a jigsaw puzzle, each piece has its own place. And when you start solving a jigsaw puzzle, some pieces will move on the board. The very first move, they'll come to their definite place and will stay there for the rest of the game. The other pieces will move all around on the board. They'll possibly go to every other place other than their own to finally reach the place where they belong. The nature has plans for you. You belong somewhere. You will reach there sooner or later. Your job is to be true to yourself, work hard, be committed. And if you're a doctor, I think the most important thing for you is to be sincere and committed to your patient's welfare. You may not know enough. Times are good now. We used to go and search for hours together in the basement of our library in Index Medical, searching through terms to look for a topic.
Right.
And now medicine is on your fingertips. You open your phone, you are in doubt about a drug. It doesn't matter if my resident doesn't know the dosage of the drug. That he can find out. But how to interpret the findings, how to examine the patient, how to communicate with him, how to make him at peace, how to follow his progress is what is more important. The drug dose is not important. Even the drug interactions are not important. So much of what is being taught is now available so information is there.
Right.
But
Absolutely.
to have the sense to separate the grain from chaff, to separate, the noise from the signal, to separate really useful information from all that crap which goes on the internet is what is important.
Sir, talking about being a great doctor, DM or MCH, and then there are fellowships, and there are training abroad, and then you do some training under a senior surgeon or a senior physician. Sir, when does this training end?
The training is a lifelong process. As Dr. Ranawat says, live and learn. As long as you're alive, it is your bounden duty to learn. So that is the problem that my family used to say, doctor mein kabhi padhai khatam nahi hoti. You never stop learning. Every day you learn new things. If nothing else, you'll come across a rare complication of a disease or a rare side effect of a drug which you have used for last 40 years of your life and never saw it. So that's a learning experience. So, and every patient teaches you something. Every disease you treat teaches you something, because it's such a imperfect science. Each human being is different. How each human being will respond to treatment is different. How it will, take or tolerate a medicine is different. How it will, and then we have now so many comorbidities. We are the diabetic capital of the world, the heart disease capital of the world. By our sheer numbers, we will become capital of the world for everything.
Right.
From cancers and everything by a sheer number. So I think the practice of medicine in India is definitely much more complex, because I always say people who are overseas, say in Australia or in USA, they have more depth. But the medicine as they practice, the field is very narrow. Right. But they have tremendous depth. We have more breadth. It's very wide. You may get a tuberculosis, you may get a polio, you may get you used to get smallpox. Sometimes once in a while you see a smallpox damaged elbow joint in a patient. So the breadth is so much. But because we have to work so hard on so many different things, we are not able to go so much in the depth. So that is the essential difference between the practice of medicine in the developed world and a developing world like ours. I think so. Till that time we take control of communicable diseases, infectious diseases, malnutrition, deficiencies,
Right.
Then we will be working only on the diseases of old age, or because of infectious diseases which will never go away, those sorts of things. So we have to be committed, we have to work hard, and this is really what is important. So the training will never end. But I think it also depends on what your aim in life is. If there are many people who are very happy to be GPs, a good GP is a precious gem.
Absolutely.
It's so difficult to find. because many times the specialists and super specialists end up being people with tubular vision. They can't see beyond their own specialty. You will have people, who end up getting their abdomen cut up to only realize that this was tuberculosis, which could have been treated with anti-tubercular treatment, whereas the advanced investigation showed something that it might even be a cancer. So a smart GP will sometimes even know where to refer the patient, and because he can really take a very broad view, and his view is not really obstructed by his specialization and over specialization. So I think, and if he is happy. On the other hand, there is a guy who's a neurosurgeon and wants to work only on AV malformations. I will be a surgeon who will only treat AV malformations. So again, like I said, that he feels that if I want to be the last word in AV malformations, I want to know more about AV malformation than any other person alive. So he'll have to go and work with people who are doing only AV malformation.
And the training goes on. So it all depends on what your aim in life is, what you want to achieve. Most people, they get married, and then they say, fine, I think I'm happy about what I'm doing in my profession. Now I'm okay. Whereas there are other couples, the husband and wife both are doctors, and they say, fine, I want to do this fellowship, you do this, you do gynae oncology, or, you do, I will do a fellowship in, the advanced laparoscopic surgery. So you become a general surgeon, then you become a laparoscopic surgeon, and then you did a fellowship in advanced laparoscopic surgery. So, there is no end to this. Right.
So you can be a specialist for right eye or left eye, but somewhere the role of work-life balance will come in. And I think there is some point where you have to say, fine, this is the place where I rest, and the rest of the life I'll build on what I've got and not sort of get into more specialized training. And second thing is the benefit accrued becomes less and less as you become senior and senior. When as a first year resident you think there's so much to learn, but once you have done residency and senior residency, that benefit which will accrue will become less. So I'll give you an example. I was the first person from India to go for bone banking fellowship in Australia. So I spent 1 year there. Everything was new to me. How to retrieve bones, how to use them, how to store them, do everything. Then I came back to India and I started bone banking. So anybody who was training with me was exposed to everything, which was like almost shocking to me when I went there. So when I sent some of them to Australia for fellowship, they were bored after 1 month. Because they thought there was nothing new there.
Absolutely.
And then they said, sir, I don't think we can spend 1 year here. So 6 months is enough. We don't want more than 6 months training, because so it all depends on what novelty is being offered, what your experience previously is, how much you have gained. But never judge or berate an institution, a person. Like I said, I've seen people work hard, get from small towns, small institutions, and work so hard to get them to the highest of the places. So the human potential is tremendous. Nobody is great because he is sitting in a great institution or he's sitting on a high pedestal. You have to show your worth everywhere. Right. And like I say, even if you are on the right track, you will get run over if you just keep sitting there. So somebody who's in a small town and keeps on working harder than you, he will definitely overtake you. You may be sitting in All India Institute or wherever you want. But if you just keep on sitting on your laurels, there are people, this is a big country, we have talented people, we have a huge population, we have people who are driven, who are energetic, who have become doctors to, tame the diseases. They'll keep on working and they'll overtake people who have been sitting there, just sitting on their laurels for a long time. So the potential for the youth is tremendous.
Sir, one question about the bias. Sir, the name itself, that I am a neurosurgeon, I am an orthopedic surgeon, I am a senior interventional cardiologist. It's a very big, fascinating thing, especially for MBBS graduates. Even for me, I used to see Professor Dhal taking rounds with 10 residents, and the aura and the respect he commanded, it was very fascinating. But sir, should this influence your decision in picking up a branch?
No, I think what you see, the thing is, you think that you are chasing the label. You know, you become good, the label will chase you. You don't
Right.
have to chase the money. You do good work, the money will chase you. You don't chase the name and fame. You do good work. You see, you don't chase anything. You have to improve yourself. You have to make every day, you should try to make yourself better than what you were yesterday. So, for example, if you become say, a psychiatrist, and then you start looking at adolescent health, I think you will have so much of name, so much of fame, and so much of money, because every parent is struggling with the adolescent attitudes, adolescent things said. There's a big gap, there's difficulty to communicate, you know.
Right.
And there is, so what I mean to say is, choose something which you like doing, work hard on it, and the label will. So, do you think that an interventional cardiologist is better than, and we were discussing it yesterday,
Right.
than a corporate counselor, a
Right.
psychiatrist, a psychologist who counsels the staff of multinationals? Look at there's no comparison between the quality of life. There's no comparison between the money earned.
Right.
There's no, I mean, what does, he will earn more than an interventional cardiologist.
Absolutely. And the respect and the
And the-
contacts and
Absolutely.
networking.
Go what excites you, what you have a passion for. That's the ideal. But this is not an ideal world. This is not a fair world. This is the real harsh reality of life. So then draw your boundaries. See, I like this best, but this is what I like second best. This is what I like third best, right? And then love what you get. Develop a passion for what you get. And say that I'm not destined to do this. I'll do it to the best of my ability, till people say, like, he's a very good radiologist, he's a very good dermatologist, he's a very good ENT surgeon. It doesn't matter the label. Ask a person who's got a pain in the tooth. For him, the dentist is the most important person in his life.
Right.
You know, and this is, ask a parent whose child has put a coin inside the trachea, and for him the ENT surgeon who just took out the coin immediately is a lifesaver. They'll actually really hero worship him for the rest of their lives. So no branch of medicine is inferior. No branch of medicine is superior. It is just a myth which you have got. And do something which you love doing, and otherwise love what you get to do. Develop a passion. If you love what you do, there cannot be a dearth of money, there cannot be a dearth of fame, there cannot be a dearth of people who appreciate you for what you are.
Perfect. Thank you so much, sir.
Thank
Thank you.
you.
I'm sure everybody, every student and every medical professional loved it and learned a lot from it.